decided they needed to listen to me even longer, which may not be a good idea. So hopefully we can get this session fairly dynamic. We can ask some questions just to get a sense of kind of who's here. How many people are a rare patient or a rare patient advocate, a rare patient parent? Okay, awesome. How many people work officially with their charitable or started their own charitable organization? Okay, how many? Because you can do like 2 or 3 of these things. How many people are sort of professional fundraisers, strategists, consultants? Awesome, very good. So we got some expertise that we can tap into. Any other big categories that I missed that people want to share? Pharma, yes, of course.
Nonprofit drug discovery.
Nonprofit, we heard from you guys yesterday. Okay, so we're going to talk about strategic planning. And like I said, hopefully this can get to be a little bit of a dynamic conversation where people can be talking about challenges that they're having. And also other people from other associations can talk about how we've solved that problem or give some sort of structures. I'm going to start with some sort of 101 type of ideas out there just to get a framework, and then we'll get into some of the discussion. So we talked about a little bit earlier about the importance of creating a plan. And there's really 2 things. One, really, from a marketing point of view, you need to have a plan, because you're not going to get people engaged, you're not going to work with community unless you can say, here's our specific plan to achieve what we're doing. And then obviously from an operational point of view, you have no idea how you're actually achieving, how you're going to improve if you don't have a plan. So obviously if you're in this session, you believe in creating it. So the first question, I'll show the answer now, that was quick. Who can tell me really what the difference is between a strategy and a plan? And there may not be any one right answer, everyone's got a different way of slicing it, but what is it, strategy and plan?
Strategy, where you want to be, plan is how you want to get there.
Okay, where you want to be and how you want to get there. Yeah, anyone else? Yeah, it's an interesting question because it seems like it should be super simple, but then when we ask ourselves, we kind of like, actually, maybe I don't really know exactly what it is. So now I'm going to do a strategic plan. Is that a strategy or is that a plan? And there's a lot of different ways to cut it, so this is not the be-all and the end-all in the gospel. But the way I look at it is basically saying a strategy is almost what you're going to do at the high level. With ultimately, what you want to have is a justification why you're going to do that. Now, that's not necessarily required. Typically, you figure out the justification, but really you're just saying what you're going to do. So, as an example, one of the strategies for a rare disease foundation, it could be, we're going to focus on recruiting newly diagnosed families. That's, one of our top strategies. Okay. And the justification, the why is, well, because newly diagnosed families raise more money. So now we can actually take a look and say, I know exactly what you're going to do, and I know why. So ultimately, at your strategy level, you want to go through all the possible things that you could do and come up with the ones that you feel are the best for your organization. And it's simply going to be what you're going to do. So you can come up with 3, 5, whatever it is, strategies that you're going to do. And what you want to do is you want to have the justification why you're going to do it, because probably one of the biggest reasons that we fail is we try to do too many things. We have all these things that are out there. So it's really a selection process to say, what's the most important things that we could do? So then a plan comes down to how you're going to do it. So it's great that we got this strategy. We're going to recruit these newly diagnosed families. How are you going to do that? So a simple example would be, we are going, and this, I'm not saying this is the best way to do it, but your plan, you could come up and say, look, we're going to place materials at the top 10 children's hospitals in the US. And that's our plan at the top level to actually achieve our strategy of getting newly diagnosed families. And when you talked about step by step, this is where we see that coming into the plan, because you actually want to see, so it's not just at the top 10, but you know what? Mary is going to go to Chicago in the 3rd week of October and drop off those pamphlets. Now you have a crystal tight strategy of a crystal tight plan. And that's it. That's all that strategic planning is. I think sometimes we use this big word, strategic planning, and now it becomes this 12-month process we're going to do. That's all you need to do. You need to figure out what are the top things that you're going to do, and then put a plan in place in terms of how you're going to do it. So a few other quick distinctions. So as an example, your strategic plan could say, we're going to focus on recruiting new families, we're going to implement patient-driven research, and we're going to leverage a train-the-trainer model to provide support to our families. That's the high level, that's my strategic plan, the strategy. And then when families talk to me and say, hey, I'm going to eliminate the challenges of XYZ disorder, really? How are you going to do that? Well, I'll tell you what I'm going to do. I'm going to keep going out and getting new families. I'm going to implement patient-driven research, and I'm going to leverage train-the-trainer model for support. Now people are like, actually, he may be able to pull that off. So now the plan, you take each one of those. So again, this first one, in terms of recruiting new families, now you get to the plan. And you say, well, you know what? My goal, we need to be specific. Recruiting new families, I could go out and recruit one new family and say, hey, I achieved my goal, I'm all happy. You need to be specific. So in this case, you're going to say, I'm going to recruit 25 patients by the end of 2014. So something that's relevant to where you are, and now it's very specific. You know, the classic, we've heard SMART goals. Everybody? Yes, nodding the head. So specific, measurable. So now we have a specific goal. I can measure if I'm there, and there's a time for me to do it, and it's realistic and actionable. Then the plan, like we talked about. So placing the materials in the top 10 children's hospital. And depending on how big your strategy is, can depend, and how big your organization is, the levels of details you need in your plan. You know what? It may be sufficient to say, you know what? Mary, because you need to have a name, someone's going to be responsible, it's not going to happen. Mary is going to create the materials, and she's going to do it by February 28th. Now, she may not need to do it all by herself. She may go out and talk to a designer, talk to 3 other people, but she's going to get it done by the 28th. And then Amy's going to place the materials in Texas by May 31st. And you just go through, and now you have a specific plan. You also want to identify the costs. And again, I would err because really at the end of the day, a lot of what we're talking about are small businesses, right? So we're not doing a $1 billion farmer strategic plan. It's a different beast. So if you look at it and say, yeah, it's going to, probably cost about $1,000, you know what? If it costs $800, $1,200, don't blow your brains out trying to get exact quotes and this and that. It's about $1,000. We're going to be close. And you also want to identify the risks. And this is a step that's a lot of times is missed. So in this case, recruiting new families, there's not a huge risk. But so if I'm from the board point of view, or if I'm an external investor, in this case we don't have investors, but if you show me the plan, I want to know, okay, well, what can go wrong? Because now I know you've thought about the problem. So in this case, the risk is, well, the children's hospitals won't take our materials. That could be the risk that we've thought of. Okay, and then obviously the step is, okay, what are you going to do to identify the risk? For small projects, not really a big deal, but if you have a big project, you want to de-risk the project at the beginning. So you want to call up the hospital and say, are you going to take my materials? Before I spend $1,000 building this out, I want to make sure you're going to do that. And that's it. Now you have your plan. So you couple that with the strategy, and you have 3 to 5 different strategies you want to do, you're done. You can do that in a day. Okay, so tracking performance. I always put it up, and then I ask you the question, so I'll take it away. Talk about KPIs, key performance indicators. Who can tell me the difference between a leading and a lagging indicator? It's kind of leading and lagging. Basically, a lagging indicator is something that comes after. So if I set a goal to raise $100,000, then my lagging indicator could be how much money I've raised, right? Because what's going to happen is if I look at it and say, oh, my goal is to raise $100,000 this year, and now it's December 31st, and I raised $80,000, then I didn't hit my goal. So it's great to have that because I understand how I'm doing. But because it's lagging, the challenge is it's too late. I've already missed my goal. So I didn't raise enough money. So it doesn't help me actually address what I'm doing. So for any of these items, you want to identify how you're going to track it. What's in this case, the lagging indicator. But you also want to, if it's possible, figure out what's the leading indicator. What's going to tell me whether I'm on track or off track before I get off track? So a simple example in this case could be, how many emails have you sent to fundraisers? Because it's pretty easy to say that, the more emails you send, the more money you get. And if that's one of your primary mechanisms for fundraising, then why don't you just track how many emails you sent out? And you'll figure out over time that, hey, if we send out so many emails, this is how much money we get. And then if you look, at the end of the first quarter or second quarter and say, guys, we only sent out like 50% of the emails we wanted to, well, guess what? Your fundraising's not going to hit the mark. So now you have an early indicator that's going to tell you need to do something about your plan before you've completely missed your targets. Any questions so far? Okay, we're going to get to the interactive part soon. So the next three things is really just different ways of looking at your organization. So we talked about the plan. That's what you want to create, a strategy with the plan. But what we want to do is give you different ways to look at it so you can come up with different ideas for things that you want to do. So this is one that isn't necessarily talked about a lot, but I think it's good to take a look at, is a top-down versus a bottom-up approach. So the top-down looks at the mission. I want to eliminate the challenges of Prader-Willi syndrome, and put together a plan to accomplish that. The bottom-up starts with, what are the three things that I can do right now that's going to help me? So you start asking these questions. Write down your mission specifically, so you have it. If you could do it right now, write it down if you got it 10 words or less. And then ask yourself, what are the three things that I need to accomplish to achieve this mission? So if your mission is to eliminate challenges, say, and through research, you do research, say, okay, well, I need to fund research. I need to have a research review process. I'm going to need that at some point. So that's a clear thing. So that's one of the things that you would need to do to accomplish that. And then the second question you ask is, what are the three things that I need to do this year to make this year the best year for our charity? And that's the bottom-up approach. So we haven't selected yet. We're just now getting all the ideas for the things that we could do for our strategy. And then we got to figure out how to prioritize it. So this is the typical way that we talk about. Sometimes I think this is sort of overhyped a little bit. We kind of jump right to this, and we don't leverage this SWOT analysis as really just another way to look at your organization. But you want to take a look at what's your organization good at in terms of strengths, what's your organization not very good at in terms of weaknesses, what are the opportunities, and this is really things that are external that could help you out. So in this case, hey, if there's new legislation providing tax relief to pharma for R&D, that may be something that is going to help you out. And the last thing is threats. So is there a competing charitable organization that I need to figure out? And again, this isn't telling you that you need to do any of these things, but it's another way to generate ideas for what you could do, and then you need to prioritize them. And then the last one that I think we want to talk about is a stakeholder analysis. And we don't talk about this enough, I think, is to really look at who are the stakeholders in your community. So patients, family, extended family, clinicians, researchers. Anyone tell me any other stakeholders? I'm sure we can think of a few more. Okay. Yep. The kids that are now, yep, absolutely. The kids that are related to our children with learning disorders. Yep. And you should write this down because there's going to be a step later. Yep. Absolutely. Policymakers/legislators. Anyone else?
Here, Keegan.
Okay. Excellent. Okay. So the other ones, you have board members, you have employees. There's a lot of other ones that you can start to think of. And what you want to do is for each one of these, just sit down and say, what do they want? Because if these are stakeholders, you got to figure out what do they want. So if we're talking about researchers, really at the end of the day, they want recognition. That's why they got into the research game. They want recognition, and you need to know that. What do they need? They need money. Okay? How can we help them? And this is probably the most important thing. It's not always about what are they going to do for me. How can we help them? Because now you have something to barter with. We can easily provide recognition. We could give them money as well. And then how can they help us? And really think about this. Don't just say, okay, researchers do research. Okay, that's the first step. But they can be a huge source in connecting families. They can fundraise for us. There's no reason why the researchers can't fundraise for us. Let's take a look at that. And the last step is just really a partial plan is better than no plan.
Because we're live streaming this, if you guys have a question, you can raise your hand and we will get a mic to you because we would like the audience that can't attend here to be able to hear your question. So you can just raise your hand.
Okay. So partial plan, don't set it up where we're going to do a year of strategic planning and then come back to it. Try and figure out and leave with your strategic plan after the end of the day or the end of the session. And you know what? You can change it. It's okay. It's not anything that's set in stone. So if you need to come back and revise it and improve it, absolutely. But at least you have a plan that you can start tracking to. And you want to make this visible once you figure it out. So eventually visible to the community, but especially visible within the board. And this is where you want to make it okay to fail. Because if we never miss our targets in the plan, then what's going to happen is we're only going to put things in the plan that we're 100% sure we're going to do. We're never going to stretch our organization, or we're never going to talk about the accountability because it's brutal if we fail. So I'm never going to say, oh, I didn't hit my target. So you need to make it okay in your organization and say, here was the plan. Yeah, we missed the target. Didn't work. Great. Now what are we going to do about it? So you need to start, and really, at the end of the day, from a board point of view, what else are you doing? I mean, we're doing fundraising, but really, you're managing the organization. You're managing the progress to the plan. That is what we need to make sure that we're doing. Okay, so enough talking. So, questions, challenges, concerns, great ideas, other ways to do strategic planning, comments about the beach? Oh, we have a mic.
I'm going to leave one up with you, actually.
Great. And again, hopefully we can get everyone else to chime in on the answers to these.
So the question I have is, now how do you get a board to liven up and participate? Because when you bring high-profile board members who are researchers, like in the board that we have at American MedCamp, getting them fired up to do fundraising, which sometimes people think fundraising is a lower-level thing to do. How do you actually bring them up to the level that it's an important work for the board to do?
Okay, and so I'm going to clarify that, and we're going to ask the group and see if we have answers. So are you talking about that planning is important for the board to do, or fundraising is important for the board to do?
Participating in the planning.
Planning, participating in the planning. Okay. So anyone have any suggestions for getting board members interested in participating in the planning? Oh, yes.
From my experience.
Oh, we have a...
From my experience, usually making I hate to say a day of it, but making sure that they know food will be served, and really, I hate to say this, I always plan our strategic planning period every November, and I I have my staff come in from out of town. We do have the day planned, but we do lunch and then go out to dinner. So I don't know, for some reason though, they know they're going to get fed, that they really want to do the strategic plan.
Anyone else? So if you didn't hear, I think the answer was, and I love that, kind of twofold, and I'm going to paraphrase. Number one, he does it at a regular time, so there's sort of a cadence. It's always November. Number two, does it in a finite amount of time, so they know they're coming in for the weekend, for the day. And number three is he feeds them. And that's probably, those three steps is you're probably pretty close to doing everything. The last thing I would add is upfront, really identifying what the roles are of the board members, and understand if this board member is participating or not. And you know what? There's 1,000 different ways to structure the board, and I think there's a great session going on there. At the end of the day, if you have a high-profile person who's on your board because they're a high-profile person and they're not participating in strategic planning, that may be okay for your structure because they're doing their role, that what you need to do them to do. And you don't need everybody to kind of go through the planning process. You need a few core people to drive it, and then you need to buy into it. So if you have someone who's not participating and then's going to show up and say, that's garbage, that's when you have a problem. And that's when you have to have that conversation with them. Any other questions? Oh.
My question.
It's going through the live stream, not the speakers.
My question is just if you have a board that's a board or a foundation that's been more focused on support and you want to redirect or start directing more towards fundraising, how do you recommend going about that? Like you said, you guys are for your disease for research and there's another organization for your disease for support. If we've been more on the support side, is there a way that people recommend rechanneling that or adding that piece to it?
Okay. So again, I'm going to ask one clarification, and then we'll ask the crowd for the wisdom. So are you thinking about rechanneling from support to research, or did you say from support to fundraising?
Fundraising that supports research.
Okay, so adding research to your mandate.
Mm-hmm.
Okay. So any thoughts on how you change an organization from sort of support-based to research-based, or to both?
Well, I think if you are working to do support people, you can kind of say that funding for research is supporting. So we have a special committee, and one of our board members leads that committee, and her job is just fundraising. So she plans all of our fundraisers and then figures out a way to implement that into our community so we can have other people do it too. So we incorporated it into our mission. Even though we're an advocacy group, we do fundraising now too.
Any other questions, comments? Oh, related to that. Sorry, I just want to keep answering that question. About changing from from support to like a research based. Is that okay? Hold on, we're going to talk about fundraising in a sec. So,
The hemophilia community, where I do a lot of work, really, which is a rare disorder, marries. And their local chapters and local organizations always have somebody from their treatment centers, so either a doc, a nurse, or the social worker, sit on their board. So they do bring that who can come back with some of that research aspect. So I would suggest for your local communities and your organizations to find some of the treaters and ask them to sit on your board, and that might help you then really develop that.
so what I would add to that. Okay. So what I would add to that is the first step is I would take fundraising out of the equation and say fundraising is kind of the lifeblood. That's something that we need to do to achieve the mission, what we're trying to do. So we park the fundraising. And then we say, okay, now we want to add research as a mandate. And that's really a fundamental mission statement, right? So ultimately, I mean, it boils down to a simple question of the board to say, hey, do we want to add research to our mission? So we eliminate the challenges of XYZ through support and research. And we're going to get the feedback. It's either yes or no. But I would say to ask yourself the next sort of fundamental question is, do we really believe that we're going to do this? Because I would be concerned about if we add research, but we really don't have the capabilities, we don't have the infrastructure, and we really don't have the inclination to do that, but we added research because we think it's going to help with the fundraising because it's sexy. Those would all be sort of red flags for me in terms of that we don't really want to do this. And at the end of the day, if the majority of the board is kind of like, hey, we're not really comfortable, this isn't where we want to go, then you have to have that sort of hard and uncomfortable conversation right at the root of it. Okay, so any other questions? Different topics now, whatever your challenges are. Or comments.
My husband is a firefighter in Oklahoma City, and for years, even before he's almost retired after being 25 years on the force, but they do a fill the boot. Do you guys do that in your states? It's for muscular dystrophy, so some of you guys probably have been impacted by what they do, and they just sit with their boots out in the street all day long, and they gather money, and people just give because they're, see, oh, there's a fireman. I don't know what you have, but here's some money. And just the fact that they get a little sticker that said, I gave.
Yep.
And when you go vote, you get a little sticker that says, I voted. And then you're promoting, even when that person wasn't necessarily aware of what you were doing, you still were promoting something. So iconically, everybody has something that they can iconically do. I don't know who came up with the fill the boot idea, but we've been doing it for a long time, and it's really, really effective.
That's awesome.
So,
round of applause. Thank you.
I just think that everybody.
Yeah, and recognition is so powerful. Like you're talking about that sticker because you did something or completed it. I mean, these badges where it says speaker or participant. I mean, that's just another form of recognition. So we have a question from Twitter, and then we'll jump over there. So our Twitter question is, and get ready because you guys have to answer this. How do you quickly delegate tasks to your community without overwhelming the core board or parents or volunteers? How do you quickly delegate tasks to your community without overwhelming the core board? Who wants to tackle that one? Oh, here you go. How do you quickly delegate tasks to your community without overwhelming the core board?
Encourage them to find something that they love to do. Don't ask them to run a golf tournament if they're a gala person. Don't ask them to run a gala if they're a marathon runner.
Yeah, I mean, that's a huge step. We see that all too often because people feel they have to do something, and then they end up doing something that they don't really like. So part of the engagement is finding out and asking up front where people are interested. Are they interested in galas, golf tournaments, writing, whatever it is? And then all of a sudden you have a way to plug them in. And the next thing I would say related to that in terms of quickly delegating to the community is we really need to, and especially because I keep coming back to a lot of our organizations are small businesses, we really need to get a separation of board activities and volunteer activities. Now, the same person can do both. There's no problem with the same person doing both. But in terms of our board activities, we're sitting down, we're reviewing the plan, we're understanding where we are as an organization. In terms of I may volunteer as a fundraiser, I may volunteer to write the newsletter, I may volunteer to keep up the website, but those are all things that I'm doing really with my volunteer hat on. And once we make that separation, then we can start delegating responsibilities, because the board doesn't need to do all these things. The board needs to manage the organization, right? So now I have a head of my newsletter, right? They're the leader. So now you're talking about delegating responsibilities. If there's a writing question, don't come and talk to me as the board. Go and talk to the head of the newsletter. Go and talk to the head of the website or whatever it is. And once you start to set up that structure, then that's when you can start to delegate those tasks, because they're not coming in to the central point of the board. They're actually going to your leaders in the community.
And it all comes back to, at some of our conferences, we do a Make Your Mark session. And Keegan does it really well, where he inspires everybody to find something they're passionate about and then sign up for it. So they'll have a list of things that they can sign up for, things that matches kind of their passions and likes and whatever. So they'll sign up for it, and then it's a follow-up. It's not a delegation. It's a follow-up of what they're passionate about. So they, in the end, come back to us and say, wow, thanks for putting me in the role that I love, instead of, you gave me this job I didn't really want to do.
Yeah, absolutely. So we had a question over here.
No, I had a comment.
Oh,
and,
okay,
and
perfect.
it seems
Even
kind of
better.
backwards now, because it was really about the board engagement and then also switching or adding to a mission. We're in a very unique position now. Up until July 1st, we had 2 organizations. We had the foundation that, of course, focused on research and funding research and public policy, and we had an association that dealt with the support, the education, advocacy at a grassroots level. And we brought those together on July 1st. And in doing that, we brought together the boards, or members of them. And so we have different thought processes going on in the community that was part of the support, education, and advocacy, going, oh, God, now it's all going to be about fundraising. And we have people in the investigators world on the research side going, now it's about the fluff. but the fact of the matter is that there needs to be a level of transparency on the cost of things that take place in the community and the cost of research. And I don't know that we've done that adequately on the support education side. And I think it's important, especially taking on this new mission. And from the investigator side, if you ask them what they want, it's dollars, but they also need participants. And so part of the strategy that we have moving forward, and even in our international forum, is when there's an investigators meeting, we're holding a patient congress. When there's a national education series, we're holding it with the meeting of our clinical resource center. So when our specialists have a meeting, it's the day following, or we get the investigators and the patients in the same place. So not only do we have an educational conference coming up where we get a huge patient cohort in there, but the experts will be there to be talking. We've, on the support education and advocacy side, have always invited the board members, have always invited the investigators, but it's not prioritized in their lifespan. Now that we're combined, we're setting people up for success in that communication. And so those value statements are very clear because they're witnessing them firsthand. So we're by necessity putting people in the same venue and letting it be known that the missions are appropriately put together, and that fundraising leads to one. If you asked a patient in taking advantage of the support, education, and advocacy routinely year after year, if you ask them what they want, number one, it's a cure for the disease. So putting those two together, then fundraising for research seems very different, because you're bringing what they really want, not what we're teaching them in session after session after session, but what they really want, access to the people that can get them there, and figuring out that the bridge is that fundraising and vice versa. So.
Yeah, that's a big endeavor that you've taken on, sort of bringing the two organizations on. So congratulations for being brave. A few things, I think we have 10 minutes to go, I would comment on that may be interesting, is you're bringing two different communities together, like you said. There's going to be questions and concerns. So number one, as much as possible, you actually want to take the money out of it and talk about here's the objectives that we want to do on the research side and on the support side. And again, like we talked about in terms of building momentum, as much as possible, now you need to have some quick wins, right? So you need to say, from the support point of view, here's, that maybe it's a small project, but things that people have talked about, and see that those get taken care of and those are done. Then all of a sudden, the anxiety levels will go down and be like, oh, actually, this may be okay. We're going to be all right. And the same thing on the research side. Figure out what are some of those things that you can do quickly. And the last thing I would say is, as you start doing your planning, now that it's together, the more specific you can be, the better, the more people are going to get bought into what you're accomplishing, not how you're slicing the pie up. Because otherwise it's going to be, okay, you took 50%, now we got 60% going to research and only 4, and it's like, you cannot get out of that discussion. You're never going to end. But if it's like, well, what are your top support goals? What do we need to do? And look, this plan is going to accomplish, 2 of the top 3 goals. And everyone's like, great. I don't care if it takes 2% of our fundraising dollars. If it accomplishes the goal, and vice versa on the research side. Maybe this year some of the things we're doing are not the great big grants. Maybe we're doing things that are, more getting information, don't cost that much. If 10% of the budget goes there, but we achieve our objectives, that's the only way to break that tie and have that conversation. So, questions? Comments? At the back, yep.
Yeah, in your talk you mentioned about how you should fail fast, basically, if you're trying to achieve your goals and sort of setting out your plan. Well, I come from a research background, actually, and we're used to failure. There's a lot of things that don't go well in our efforts, and you have to regroup and come back at it again with a new hypothesis and really re-energize when it comes down to confronting failure. How do you recommend to your organizations they deal with failure? How do they regroup? What's sort of your strategy for remotivating people?
Yeah, I'll answer that in a sec. Anyone want to take that? How do you remotivate after failure? Okay, so I'll jump in. So there's a few things. The first one, and this is actually kind of a research principle, and all the tech companies do that, is you want to de-risk the plan as early as possible. So in terms of fail fast, like the example is you want to call the hospital right now to say, do you take pamphlets? So the earlier you can fail in the process, the better, because now you haven't invested, and research is different, 3 years and $20 million in a clinical trial, and then you failed. So that's the number one. Number two, you have to establish that sort of annual, and this is part of that whole revival type thing, where you are reviewing where you are, and you're projecting, here's where we're going next. That way it's not this aberration like, oh my God, we failed and what's going on. It's part of that standard thing. This is what we set out to do last year. This is what worked. This is what didn't work. And this is where we're going now, and it's a plan that everybody's bought into. And that way you get out of discussing this specific issue, this specific failure, and the pain related to it, and it's more, this is actually part of the process. And effectively that's what happens in research. Like, you have a process, everybody knows the research process, so it's not this personal thing like you're a bad person if you did your experiment and you didn't get the result. Actually, that's research. Whereas all of a sudden, if we look on the community point of view, this failure is now personal. It's like, oh my God, you failed at that fundraising event. So we have to get out of the personal and get into, here's the objective, here's the plan. So I always say, if there's a failure, you want to go back and understand, is this a failure of the plan or a failure of the execution? Right? So you go back, and if it's a failure of the plan, you adjust the plan, and you come up with a new plan, and this is where we're going to go. If it's a failure of the execution, you say, okay, we had the right plan, so we're not changing the plan. Plan's good, but we couldn't execute on the plan. Okay, why not? And what are we going to do in terms of accountability, in terms of new resources or whatever to execute on it?
And I think it comes back to what you said at the very beginning today. At that point, you're presented with a choice. And the choice is, am I going to choose to continue on And if you choose to continue on, you overcome that failure. So I could choose to try again, or I could choose to give up. And I don't give up. I'm a fighter, so that's easy.
Yeah, and actually that's a great point in terms of when I said the characteristics of the organization start to take on the characteristics of the leadership and the messaging. And we got, fighters in the room, and that's a lot about what we talk about in the community, how we are fighters, and we've went through these challenges of finding out that our children or ourselves have these rare disorders, and it almost becomes a part of the identity. And like, we're fighters. So then all of a sudden when you have a challenge come up, it's like, well, no, don't even worry about that. We're fighters. That's who we are. It becomes a part of us. And that's how you build that resiliency in the community.
There's a huge amount of data that comes from failing. So it's not just you fail and then you're done. You fail and then you have all of this, like a litany of information that wouldn't have been at your disposal if you had just taken somebody else's word for it. Now we've learned ourselves.
Yeah, we got to start using a different word. Because, the researchers talk about failure completely differently in terms of a word than sort of the general community. Right? The general community is like, you failed. Stop, go home. It's over. The researchers is just a way to get more data, which is exactly what you said. So, pardon? Rerouted. Yeah, we got rerouted. Okay, I think we have 5 minutes. 3 minutes. 3 minutes. Do we have a...
Just to comment on this failure, as when you get a PhD in a science, you have already been taught about delayed gratification, delayed success. Over 5 years, it's drilled into you. So,
yeah.
From your own experience, your child was diagnosed early on, very early on.
Correct.
You, in your talk, you quickly did a fundraiser. It looks like you quickly got involved. How did you find the time? Because even just a healthy baby takes a lot of time. How did you find the time to start all of this and get going? And what kind of time management advice can you give us?
So I think really the best and the most accurate answer is my wife is very motivated. At the end of the day, that's really the most accurate answer. But I'll answer it also in another way, is because kind of looking back, and it did take time. So I'll answer it another way, is what we did and what a lot of the success came from is we started taking all of that time away from the rest of our members, right? So, and I don't want to create a fundraising package because I think fundraising packages are, kind of old and outdated. And even asking people to read a package, I don't like to read instructions. I'm just not going to do it. So when we talk to people, and if we're talking about fundraising, when we talk about the mission, we talk about this is what we're going to do, and everyone's like, yes, I'm there. We talk about the plan. They're like, I believe in that plan. And part of that plan is we're going to, get people involved, and we have our one small step walk. Everyone's like right there. And then what we say is, and what we need you to do is book a park and pick a date. Right? So I'm not at this point asking you to do this great big fundraising development plan. I'm not asking you to do all this work. I'm saying I want you to book a park and book a date. And now from an organization point of view, we're now going to support you and make sure that's easy to do. And the last thing we want to do is we want to lower the bar. Right? So we don't want people, and this is part of the failure thing, we don't want people thinking that I need to get involved, I need to do, the jumping castles and the clowns. And we actually tell people this. When we ran our first event, we had the jumping castles and the clowns. Seriously. And we had because we were just all in and we were doing all this stuff. People were there for like 4 or 5 hours. We raised the $50,000, which is great. I can tell you now, we'll have an event, we'll raise $100,000. We don't have any of that. And our friends and our family were like, you know what, Keegan, we love you. And we're going to be there to support you, whatever it is. But if you can save me 2 or 3 hours on a Sunday at an event, that's better. I'm not coming because your clown is that funny. It's really not the case. I'm coming to fundraise. So we've really slimmed it down. And we tell our fundraisers, you book a park, you pick a date, you get 10 people, your friends and family to show up. That's a fundraiser. Now you've taken a step. And that's it. So it doesn't need to be this great big thing. So we make it simple, 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 simple. Now, if you decide that you want to take the next step, we're going to support you and do that. But really slim it down so people don't have to answer that question. Everybody can go to a park, with 10 friends and family. It's a weekend. Like, it's really that simple. It's that simple. If every family, like I said, raised that $500, and I mean, inevitably, people say they're going to raise 500, and they just got a diagnosis of a rare disorder, and they book a park, and they got 10 people. They'll raise $5,000 without even thinking. But they can't take that first step until you lower the bar for them. Yeah. Oh.
All right. Well, I come from the community of undiagnosed.
Yes.
And so I'm going to throw a kink in your chain because the biggest challenge we have in the undiagnosed community, and what everybody here has a target. They have a disease. They know what their common denominator is. But when you do not have a diagnosis, when you don't know what you're fighting, it's very hard to rally a community because it's like, how do you come up with a mission, goals, and strategic planning when you don't know what you're fighting? I would love to say that my son had X, Y, Z because then I would know, is my mission research oriented? Is my mission fundraising? Is my mission education? But if I don't know what it is, I don't have anything to research. I don't have anything to educate.
So what do you want to do?
My goal, my mission is to eliminate the challenges of being undiagnosed by eliminating the barriers to diagnosis.
Okay. So you want to eliminate the challenges of being undiagnosed.
Having an undiagnosed condition.
That's a great mission. And
Yeah.
that's something that people will rally around.
Right.
And if you start to say, and you start to paint the picture that I don't know the exact estimate, but there's probably 30 million people undiagnosed. They say maybe it's 15. For every diagnosed, there's one diagnosed.
Well, and it takes an average of 7+ years for a patient with a rare
but
disease
now you
to
have
get
a
a
mission.
diagnosis.
And that means there's 15 million people that actually want that same mission. And if they don't want that, they're not going to be a part of your group. And that's great. But you now have a very specific mission. You could say, we want to get everybody diagnosed who's undiagnosed. Awesome. People will stand up and rally for that specific thing.
Or $2,000 or $20,000, it could go towards your personal mission, and there's nothing wrong with that.
So if there's an undiagnosed walk, like what you're saying, it's got to start somewhere. Maybe there is already, I don't know. But if you have that, there's going to be tons of people who are undiagnosed who are going to come to your event, and they're going to say, I'm going to actually help fundraise because I want to get diagnosed for my child. Now, you need to have a plan to say, here's our mission. The next thing is say, okay, before I fundraise, what's your plan to help get people diagnosed? And if you don't have that plan, they're going to be like, yeah, you're not really going to do it. But again, you now have a defined mission. Now you need to put together the plan. And if people say, I like that mission, I'm all in, I'm not diagnosed, I believe in your plan, then you're off to the races.